Thank you. It is a great pleasure for me to be participating in this conference. I'd like to thank to Dr. Weber, who especially invited me to attend this meeting. I have been working on low-level electrical waves, no magnetic, for the last 10 years, especially for development in imaging technique based on tomography techniques. And only in the last 5 years, I have been working on the implementation of electrical waves to cancer treatment. Today, I would like to introduce our technique for, namely ECCT, Electro-Capacitive cancer therapy for lung, liver, bone, and brain metastasized brain cancer. So the outline of my presentation today is I would like to introduce the background principle of electro-capacitive cancer therapy, the treatment planning system, the process and progress of ECCT treatment, problem and issues during ECCT treatment, and some serial cases for stage 4 breast cancer metastasized to lung, liver, bone, and brain. Metastasized breast cancer to vital organs. It is especially the main cause for fatality related to breast cancer. Unfortunately, the prognosis of the metastasis breast cancer is very poor. In the developed countries, only 22%, and even much more worse in the developing country. So far, the methods for that has been proven to be effective to prevent the metastasis or cure the metastasized breast cancer. We have developed the ECCT for the last 5 years, and it is quite effective to prevent or even cure the metastasized breast cancer. The principle of ECCT is basically it is a direct electrical stimulation to cells. In some way, it is the same as electrical acupuncture. So, the technique of ECCT is how to generate electric polarization in the tumor site using non-contact electrostatic wave. So, basically, if we have tumor here, and there is electrical wave source as positive to transmit positive electrical source, electrical wave, and the electrical wave will sink into the negative electrodes, and the distributions of electrical field is very important for the effective treatment of using ECCT, and it is governed by electrical field intensity distribution based on Maxwell equation for electromagnetic field. So here we are using Poisson equation, where epsilon is the permittivity and sigma is conductivity. So it is basically the electrical properties of cancer cells. So there's electrical properties of cancer cell will determines the effectiveness of the cancer treatment. E is electrical field intensity to be optimized, and rho is charge density inside the tumor treating field. In breast cancer cases, charge density is usually 0, but in the case of brain cancer, charge density is coming from the electrical charge from neuroactivity. So the treatment of using ECCT is basically how to design the electrodes as a source and the same to distribute the electrical field in certain way to get the effective electrical intensity in the tumor sites. In the case of brain cancer, breast cancer here, we need we need to localize the tumor based on the MRI scan or CT scan, and based on the MRI scan, then we generate a modeling for finite element methods for computation of the electrical field, and then capacitive design to be done based on the the location of the tumor, and then the electrical field intensity distribution need to be optimized to get the required enough intensity in the location of the tumor. The equipment is basically comprising into two parts, which is apparel, basically electrodes embedded in apparel to be wear by the patients as in daily activities, and connected to oscillator, which is basically a pulse power supply. Here, because we are using only very low level electrical wave, it's only as a DC pulse with frequency between 50 to 100 kilohertz and intensity between 10 to 30 volts. What's the difference between the it's been developments in a quite similar way using electrical field. It's called tumor treating field. It's in the branding is Novacure. It's in US and Israel. So the difference between ECCT and Novacure is that ECCT is basically is capacitive. It is completely non-contact. It is penetrating through air layers, so we can have layers between the tumor and the source of electrical waves. And we are using much low voltage, less than 30 volt peak to peak. It means 15 plus minus 15 volts. So it can be powered by regular batteries. And it is effective to air contact or interfacial tumor, and it is not quite good for a solid tumor. I mean, it is bulk tumor, so it is good for interfacial the interface tumor, but not in the center of the tumor. And as compared to ECCT, Novacure is actually quasi-electrostatic because it is quasi-conductive. It's using high conductive ceramic which is in direct contact with the skin. So it's consequently is no air layer provided because it is conductive material will not go through to the air. And Novacure, based on the principle, it is working to block solid tumor, but not working for air contact tumor. So how the ECCT works is basically how ECCT kills the cancer cells and why it does not affect the normal cells. So here it is the report for dielectric properties of tumor cells as compared to normal cell. So here we have basically electrical properties of tumor cells in the lower part of this. Basically, it is the dielectric properties. The higher is the lower dielectric properties, and here the higher dielectric properties. We have for normal cell, it is quite lower dielectric properties or lower electrical properties as compared to tumors. This with the difference in the dielectric properties, it means that normal cell will respond in different way to the external electric field as compared to tumor cells. To show the difference between normal cell and cancer cell and for breast cancer, we have developed namely electrical capacitive volume tomography. So basically it's volumetric tomography based on the electrical images of the cancer. So using this technique, this technique has been developed for 10 years. This one is the one application of the technique to get the image instantly the breast cancer. So here we have an image of benign tumor, breast tumor as compared to mammogram, and malignant cancer as compared to mammogram. If you will see here, you can see how the electrical images of the benign tumor is much different as compared to malignant cancer. Malignant cancer has very high electrical properties as compared to benign tumor, as well as the normal breast tissue. This is the image of the breast cancer using the electrical imaging technique as compared to sonogram, and this one is similar as compared to for benign tumor for mammogram and sonogram. And how to interpret the image of breast cancer using the electrical imaging actually is quite similar with the PET scan. Here physiological activity is actually this electron transport, so it is electrical activity. In the PET scan, we are using FDG, and the FDG is transmitted by positron. These positrons will meet the electron from the physiological activity and conducting what's called annihilation effect to generate gamma ray. And the gamma ray is used and detected to generate the image of PET. And using the electrical capacitance tomography, actually we can directly image the electron activity. So we can get the electrical activity of the breast. It's actually this is quite correlating with the PET scan. So ECBD is more or less can be interpreted as the negative of the PET scan. So we can, with the ECBD, actually we can differentiate between normal cell, benign tumor, and cancers. In the same way, we can use the FDG for using PET. This is the image of the ECBD as compared with the PET. So we can show the electrical properties of breast cancer is here for benign. This normal tumor is here, and this for benign tumor on single cyst. And here is the malignant cancer of breast cancer. This normal breast, this initial development of breast cancer, this quite extensive breast cancer. So this is the basic principle how electrical wave will interact with cancer cells. And the more prominent interactions between electrical wave and cancer cell is actually happen in the process of cell division. In the stationary condition, actually the cancer cells electrical activity is quite higher than normal cell, but in the phase of splitting on divisions of the cell, the electrical activity is much higher than normal cancer cell in the station, in the G state. So here, because the cell divisions are actually the activity of microtubule. This microtubule is a construction of hypermolecule constructed from tubulin dimer, which is quite highly polarized, electrically polarized. So microtubule is the molecule inside the cancer cell which is the most sensitive to electrical wave. So by setting the intensity of the electrical wave in very low level, so the electrical wave will only interact with the cancer cell during the mitosis. So this is how the process of mitosis and the external wave will disrupt the mitosis process. And this one is the experiment by Novak team using the electrical field for inhibiting the cancer cell growth. So actually you can see how the cancer is exploded, like disrupted during the mitosis. And here is the in vitro test for human breast cancer as compared to a control and treated one. Actually, the electrical waveform is quite interact in different way to the cancer cells. As the growth of cancer is quite having a significant effect to the growth of the cancer, and there's quite no change in the normal cell. How this cancer is actually working on the electrical wave is working on the cancer, as you can see, it's quite illustrative to the actual what happened. The actual what happened during the process of treatment using ECCT to breast cancer, which is already open wound. And you can see here how the cancer cell is like melting, while normal cell is not affected by the electrical field. And after the melted cancer cell is discharged to outside the body, the normal cell is conducting regeneration. But if you see how long it will take for destroying the cancer cell and regenerating the normal cell, actually the destruction of the cancer cell takes quite very short time. It's only usually only less than 6 months, but to regenerate the normal cell to completely heal the wound takes quite long time, more than 1 year. So actually the same patients have received chemo for 6 months, and then after chemo they get the treatment of the ECCT. You can see how different the process of chemo and the process of ECCT treatment. The chemo can shrink the size of the tumor, but you can see how the normal cell is actually dying as well. And here, using the ECCT, the cancer cell is melted, but the normal cell is not affected and even regrow to regenerate. So there are 3 steps for effective ECCT treatment. One, killing the cancer cell using the electrical wave. So the process is not that long. Usually 3 to 6 months it can completely kill the cancer cell. But the problem usually happen when the dead cell is not absorbed or discharged completely to outside the body or not absorbed well by the body. So the process of the complete cure for treatment using ECCT will determined by the second step of absorbing dead cell, and the third step is regenerating normal cells. So it can be combined with different methods like immunotherapy or PDT. So it is possible to help the absorption of the dead cell or even the regeneration of the normal cell. So this is a very important step for ECCT treatment is treatment planning system. This concept is basically quite similar with the radiotherapy. So radiotherapy, the ECCT therapy needs to optimize the field where the tumor is sited and how to get the distributions of the electrical field to be effective. The intensity is good enough to destroy the cancer cell. So the basic concept of the treatment planning system using ECCT is actually quite similar to what's called the coverage of radiation field in radiotherapy for breast cancer. Here you can see how the coverage of radiotherapy, means how to block the possible way that metastasis happen. So this the same way how the electrical field to be distributed to block the possible way for metastasis. So there's basic concept for treatment planning system is coverage. There are 2 principal coverage for ECCT. The first is for global coverage, which is used to prevent or clean up metastasis and suited to small and distributed nodules, which doesn't regardless of the extent of the distribution or spread of the cancer cell all over the body. As long as it is covered by the electrical wave, it is no problem to have metastasis all over the body. So it is used, it can be used before and after surgery and can be combined with conventional or other methods for chemo, radiations, to prevent or to clean up the metastasis. But in the case of not possible for other treatment, actually ECCT can be used to treat local tumor, but it needs a local coverage. It must be customized, body fitted, and based on the location of the man. So in Indonesia, we combine this one with the sewing machine. So it must be a sewing machine people that do for fitting the equipment to the body. So local coverage is used for big lamp, local man, and local treatment, and usually used for treating stage 2 to 4 breast cancer. Because there is a shortage of time, I just will to scan briefly the pathology analysis. Basically, after 1 month is the pathology analysis show is like a crashing effect, crashing aspects of this. The morphology of the cell is not identified well. So this one of the breast cancer is after the treatment is quite widely processed, but the cell is dying and not found active cell from this lung. This one is also showing how the cancer after treatment and after the surgery is found that no cells is still active in these conditions of the tumor. I would like to just show how actually cancer electrical field is actually respond in different way to cancer is response to different in different way to electrical field is based on the electrical properties. So during the treatment, you saw how the electrical properties is decreasing, and so as this one is compared to the ultrasonography. And here how the electrical field is electrical properties of the tumor is decreasing. It means that the malignancy of the tumor is decreasing. And here the image of the this one is the electrical property, decreasing electrical properties, and here the image of the mammography showing the disappearing of the lump. For small nodule, it can disappear within 6 months, and for big nodule, it's like melted away, and the disappearance of the big nodule will related to the process of the absorptions of the dead cell by the body. Just quite similar, is the same thing here. This big lump can disappear. Usually the cancer treatment is not so long, but the removal of the dead cell takes quite long. For this big lump, for 5 centimeters, can disappear within 2 years. This another case here for 2 years. This one is for 2 years. This one is killing the tumor is only from this one to this one is only 1 month. Another 1 month, if there is open wound to discharge the dead cell, so the wound will heal accordingly. But the response to external electrical wave is quite different between different breast cancer. Here, this the quite already spread all over the skin, and this one is not like melted, but it's just dying. So this the dying cancer cell, and the blackened and the black dying cancer cell is peeled away after a dead cell. So as a summary is how the ECCT response versus the ECCT index malignancy here. In this, the response of the breast cancer is divided into 3 groups. This A group is like liquefied. So this is how the solid lump changed into liquids, and the liquids when discharged, so it is the lump is disappeared. This one, the group B, is like the process of melting. So when the cancer is melted, so the lump will disappear. But this B group is around this this level. But there is another group that is called a C group. C group is not responding like melting or liquefying, but it's just solid, and the solid is dying. So the process of the dying cancers is in this way. So this only just the lump is disappear, but like the whole lump is flat. This one is usually for very high electrical activity of the cancer. The group B is middle electrical activity of the cancer, and group A is lower level electric. So this one is a different example for the group A. This group B. This one is for group C. So for metastatic breast cancer is metastasis to bones. The spread is happen all over the body, and the patient has not been able to get up from the bed for 7 months, and after another 7 months of treatment, as you can see here, how this almost clean up. And this one is the after 7 months of treatment, and this one is from the before and after. Actually, you can see how the whole cancer has already spread out all over the body, is not affected in the patient. In other cases, for breast to metastasized to the lung. So this patient has been treated for 3 years, and still you can see how the lung on the lung gradually disappear, and the wound and the breast is healed. And this one, this patient is now is still in the healthy condition and doing daily activities as normal. This for breast metastasis to lung and liver is around 2 years for complete heal of the one. This for case of the liver metastasis, and for all over the body, including brain, is liver. So finally, this one is how this statistical is actually with the longer the usage of the ECCT, it is the longer of the survival rate increases. For the 3 years of using the survival rate is more than 90%. But for initial usage less than 1 year, the survival rate is only 60%. This because the number of the patients, 70% of the patients treated is already in the final screen. So the first year is quite crucial to get the survival. So this the closer as the factors to affect the ECCT treatment. For effective treatment is the position, staging, and pathology analysis. The grade of malignancy is basically determined by the cell electrical properties. So there are 3 components which must to be optimized for ECCT treatment: the coverage, intensity, and the usage. If these 3 components are well designed, so you can get effective treatment using ECCT, and to get the cure for even in the final stage of breast cancer. That's all for my presentation today, and thank you for your attention.